Talking about the ligament sprains, the medial collateral ligament are the most common to be injured. We have seen a mechanism of injury wherein there is a flexed knee and a twisting in the knee happening. For example, in terms of low level trauma, we can see if someone is standing from sitting and they just lost their balance, or someone is getting up of a chair and they just tweaked a bit, and if someone just stumbled while walking, or also when someone is reaching over and he fell off by jumping ahead with a poor landing. Also, seeing a sports injury is very common. People having a side to side movement biases are seen, and then there is that awkwardly twisting the knee injury happening. So we can easily compare the grades of ligament injuries starting from mild to moderate to severe. In the grade 1, there is a stretch in the ligament, and that's also known as low grade injury. In the grade 2, there is a partial tear in the ligament. We have grade 2A and a grade 2B. So grade 2A is low partial, that is low grade partial tear in the ligament, less than 50 mm. Grade 2B is a high grade partial ligament tear with the mm being more than 50 mm. Grade 3, there is a complete tear in the ligament or there can be a rupture, and it is also known as high grade ligament injury. The symptoms being pain and tenderness in the grade 1. There is more pain, there is swelling, there is a laxity of the ligament being 5 to 10 mm. In the grade 3, there is pain, swelling, tenderness plus instability, and a 10 mm or more than 10 mm laxity. Now the healing takes place about 5 to 7 days for the mild injury, 2 to 4 weeks for the moderate injury, and 4 to 8 weeks for the severe sort of injury. To differentiate between grade 1, grade 2 and grade 3 injury, we have a special test that is known as valgus stress test. We perform the test in two parts, being valgus stress given in knee full extension, that is when the knee is in 0 degrees, and another one being in 30 degree of knee flexion. Plus, we also need to make sure that the knee is externally rotated while performing this test. Now, ideally, it is best to examine the knee immediately after the injury, just the reason being before the muscle spasm occurs. If there is a muscle spasm, we cannot really differentiate. In case a severe muscle spasm has been occurred, so we usually go for a 24-hour immobilization, and in rare cases we examine under anesthesia. Now, why valgus stress test is done is to assess the medial joint space widening and to feel the end point. Most often we get to see that there is an ACL involvement with MCL injury, and this requires surgery. If this ACL is missed out, and especially the POL is missed out, we get to see an incomplete healing and thereby chronic valgus and a rotational instability and functional limitations in the knee. Now coming to the physiotherapeutic management, we have divided the phases into phase 1 and a phase 2. In phase 1 includes 3 weeks post injury in case of grade 1 injury and 6 weeks post injury in terms of grade 2 or 3. We start off using crutches and braces and restricted weight bearing for mobility. Alright, when do we progress to no crutches or braces are when we can walk without limping. A short hinged brace is used for 3 to 6 weeks based on the severity of the injury. Icing is very essential to reduce the swelling. We can ice for about 20 minutes 3 times a day, and we can elevate our legs. We can use elastic stockings if there is severe swelling, and we need to be very careful to avoid pivoting or twisting movements, especially when getting out of a car or walking on an uneven terrain or a slippery floor or uneven floor. So as soon as the swelling and pain subsides, that could take about 2 to 3 weeks, we start off with regaining the range of motion for the knee. Now, start off with a basic stationary cycle that can be performed twice a day for 5 to 7 days a week. This will help in increasing the knee flexion range, especially. Now, once the braces are off, we can start off with range of motion and strengthening exercises, starting off with the quadricep sets, that too of 1 to 2 sets, including 15 to 20 repetitions. Then heel slides, 1 set, 5 to 15 minutes. Then straight leg raises, 3 sets of 10 repetitions. Next, short arc lifts for 3 sets, again 10 repetitions. Then hamstring curls and toe raises in standing for 3 sets, 10 repetitions. Then hip abduction, partial squats and wall slides, each for 3 sets, 12 to 15 repetitions. Another thing we can use in phase 1 is swimming, the flutter kicks only. Next, we will proceed to phase 2, that starts after 3 weeks for grade 1 injury and 6 weeks after grade 2 or grade 3 injury. Starting off with the range of motion and strengthening exercises, basically we will be including all the exercises that we've included in the phase 1. Along with them, we will be progressing now on. This phase will include the single leg progression. So before we go on to the exercises, we really need to be precautious about certain things, such as pain at the patella tendon site should not be there. If at all there is crepitus at patella, we need to modify the exercising protocol and we need to gradually progress. We don't have to rush or ego lift in any way, and simply we need to do the exercise in a slow manner, having a mind and muscle connection, and there should not be any quick change in direction sort of exercises. You will have to be consistent with your exercise schedules, and you have to really perform the warm up and cool down stretches. You need and always start off with compound movements first and then go for isolated muscle training. Now, what all exercises we can include in phase 2 are toe raises, that too single leg toe raises, can be done 3 set of 10 repetitions even in these exercises. So there are leg press, there are hamstring curls, there are Romanian deadlifts, squats using a chair, and we can progress the squats from 0 to 90 degree knee flexion. And then there is knee extension exercise on the machine, the short arc one. Then we can use a leg press machine as well. We can train our hip abductors and adductors and the flexors using all the gym equipments. So make sure these exercises are done 3 days a week, and stretching has to be included definitely for the quadriceps, for the hamstrings, for the calf, 3 to 5 repetitions for 15 to 30 second hold. Then we'll go on to cardiovascular conditioning as well in this phase. Make sure you include walking, especially treadmill walking, inclined walking, and stationary bicycle, rowing, elliptical, and even aqua workouts. Aqua therapy will be very beneficial. These can be done for 1 to 2 days a week for 20 to 30 minutes. Then we can progress to our jumping and plyometric drills. And then in a way we can return to our activities of daily living, as well as sports or sports specific drills can be performed. Just make sure that you're cautious when you're doing deep squats, like more than 90 degree of knee flexion, and lunges and leg extension machine. Be careful with the plyometric movements as well.